Hi, and welcome to Stressed, the podcast to develop your stress resilience. Being ambitious and successful while living a happy life is possible. Learn how you can better cope with stress in day-to-day situations by applying tools and techniques that work for you. My name is Julia Arndt, and I'm extremely grateful that you decided to check out my podcast today. Let's get started. Hi, Amber. Welcome to my podcast. How are you today?
Hello. Thank you. Good. I'm doing wonderful. It's an honor to be here.
I'm really excited to have you here. We tried already to record this podcast yesterday, but we had some last-minute disturbances, so everything worked out great, and I'm excited to have you here today. Thank you.
Yeah. Thank you for being flexible. Yeah, we'll definitely get through everything.
Of course. How are you today? What have you been up to today?
Yeah, well, so what did I do this morning? I did some computer work this morning, made some phone calls, followed up on some patient work, and then drank some coffee. Well, I did that. That was for about maybe 3 hours, and then I went to the gym around noon, came home, took a shower. I've kind of been doing a little bit of intermittent fasting. So,
Okay.
yeah, so did that, and then uh, usually in the mornings, I'll take 10-15 minutes where I will either go in the backyard or the front yard. There's a beautiful view of the ocean, and I'll set a timer on my phone and meditate for 10 minutes, which is super grounding and kind of sets the tone for the whole day. So, yeah, that's a practice that I didn't used to do. I honestly didn't meditate a ton in med school. But kind of in my last year, I started meditating more and have made it a regular practice with my boyfriend, who also kind of inspired me to do that. So
nice. That's awesome. Yeah. So these morning practices and routines are so important to ground us and to bring us through the day. So I'm glad you're mentioning it. So tell us about your beautiful view. Where are you located?
Yes. So I'm in Redondo Beach, California. So it's the south side of LA. We call it like the best kept secret in LA. It's this quaint little oceanside spot. There's a clinic here that I work in, and I'm really close to the ocean, so I love it here.
Nice. Yeah, it's beautiful. I've actually been to Redondo Beach. My fiance's family comes from Redondo Beach.
Really? Oh, wow. Small world.
It is a really small world. Yeah. When you mentioned that yesterday, I was like, oh, Redondo Beach. That's so funny. I've been there. Yeah.
Huh. How about that?
Really, really beautiful there. So I can totally relate to the beautiful views and the kind of the more serene area of the LA greater, like hustle and bustle.
Yes. Yep. Yeah, absolutely. It's definitely a sweet little spot to be.
Yeah, nice. Yeah. So we met a couple of months ago at a woman entrepreneur kind of empowering conference, and I met you, and I said to you, you are a doctor, and I would love to have you on my podcast because I want to help people a little bit more to understand what really happens in our body when we're feeling stressed. So tell us a little bit more before we jump into this whole topic that we could probably talk about forever. But tell us a little bit more maybe about your journey and how you got to become a doctor and what you're doing today.
Sure. Awesome. Yeah, and it was serendipitous to me too at that event because I remember you were sharing with me what you talk a lot about, which is working with women in stress and finding balance in their life. So that's a lot of what I do, talking with women about that, but then being able to run labs and kind of getting down to the physiology of what's going on, which is really powerful for anyone, but especially women, to understand that when they are feeling stress and anxiety, when they're feeling even like waves of depression and anxiety is very common, that we can trace that. We can look at the physiology and look at what's going on in the body, and it's a lot of times we internalize it and we're like, why am I feeling this way? It's, what is it about me? And we kind of go to this place of self-blame
Mhm.
and trying to wish that away. But when I really love the idea of looking at the psychology and addressing that. Maybe there's trauma, maybe there is a situation in life, and maybe we need to work through that and deal with that and journal about it, and
Mhm.
and maybe work with a counselor, whatever that may be. But first of all, looking at the physiology. So, what's going on in the body? Are we making the neurotransmitters? What's happening with cortisol? What's happening with your body's ability to cope with the stress? Are we giving you the right resources to do that? So that's where I really come in, and I think it's
Mhm.
helpful to start there. You
Mhm.
know,
Mhm.
because when your body is in a healthy place, making all of these, serotonin, happy chemical, and dopamine, and having the ability to regulate cortisol. Looking at the physiology helps with the psychology piece when we're dealing with those emotions. It helps us to be
Mhm.
more grounded and balanced in our the way our body works. So that's what I like to explain it to patients. Anxiety and depression are very, very common with
Mhm.
almost everyone I see in office. There's some type of, mood disturbance. And uh, I remember listening to a doctor who came and spoke to us in med school about how chronic stress is a predisposition to depression. And he explained why.
Mhm.
And how our body, and we can talk more about that, but when I heard that lecture, it blew my mind
Yeah.
because I was like, everybody needs to know this.
Yeah.
How when we go through a stressful period, you can usually trace it to either anxiety or depression later on if
Mhm.
we're not supporting the body through that period. So it's so critical,
Mhm.
um, to love your body with nutrition and also working on the mindset. So I really think that naturopathic medicine, I'm a naturopathic doctor, is the best of both worlds where we're looking at we're looking at physiology, and then we're also looking at circumstances and stressful situations. We're definitely looking at the whole person too. So
Mhm.
yeah.
Yeah, tell us a little bit
Yeah,
more about what your specialty is and how yeah,
sure.
how you're
Yeah.
looking at everything. I think a lot of people don't know, so I think it'll be really helpful.
Yeah. So a naturopathic doctor is trained similar to an MD in terms of years of med school. So we have 4 years of med school.
Mhm.
We have 2 rounds of boards. It's very involved in learning the physiology and learning lab testing and diagnosis and all the nitty gritty details of that. So it's a very, let's say, stressful process just to get through
Mhm.
that I've undergone myself. And but the beauty of what the medicine is it's looking at every aspect. So if a woman comes into me with fatigue or anxiety, I'm looking at every system of the body. So
Mhm.
I do like a kind of a full scan. You take your car in, they'll do like a full scan, they'll tell you everything that needs to be fixed. So we kind
Mhm.
of do that for the body, where we're looking at not just if they have anxiety, I'm not just looking at the brain and mood. I'm looking at their gut, and I'm looking at their thyroid, and I'm looking at um, you know their immune system, and I'm looking at their adrenals and
Mhm.
pretty much every system in the body, and taking all of those and saying, okay, well, what is suffering right now? Where are there imbalances? Where are the labs showing that there's a deficiency?
Mhm.
And then targeting that and treating that, and supporting the body to heal itself, really, with more natural treatments. So um, we can run all sorts of labs. We can look at blood labs. We can look at stool. We can take urine, and then we can also do saliva, where we do test cortisol levels 4 times a day.
Okay.
So all of those are kind of detection. And then, of course, we use symptoms and labs together to really see, what's going on, get a fuller picture of the situation and what the patient's experiencing. And then we use things like therapeutic nutrition and targeted supplementation. We can use injectable vitamins if they're having absorption issues in the gut. We can use IV therapy. We can use some of the regenerative medicine techniques. We can use, medical detox. There's so many things that we can use to really help a woman to feel better. And then I specialize in hormones, women's hormones, and testing, treatment, bioidenticals for women who are going through perimenopause and menopause, just kind of making that transition a lot smoother. And one of the really critical pieces to how severe menopause is for a woman is how stressed out she is going into it. Because the adrenals take on so much of the work when the ovaries kind of start fading away. The adrenals take that. So stress for a woman, whether she's young or 50, is such a, I think, valuable topic on how we can support the body under stress.
Yeah. Okay, you're touching upon so many interesting topics. I'm like, okay, let me try to sort my mind. So the first thing I think that would be really interesting to hear more about is, I think it's really powerful that we can actually prove that people are stressed and that you can see it in the physiology and when you're doing lab tests. What are the most interesting factors that you're looking at that show you or a person is really stressed out?
Yeah. Well, namely cortisol. So we're looking at there's a panel that I like to run. It's called a Dutch test, and it's a dried urine panel, and it can tell us all about estrogen, progesterone, testosterone, cortisol throughout the day. So we get a 4-point cortisol 4 different times of the day, and then it'll tell us about melatonin. So the main ones that, stress will be reflected first in the cortisol levels and the melatonin, and then generally show up in other areas of the body, like the thyroid, like the reproductive organs, the ovaries. So it'll show up in altered estrogen, progesterone, testosterone levels later on. But where we're first seeing that is looking at the salivary cortisol. And they sometimes will do it in serum, so they'll do a blood test, but you can only get one value, so you can only run that in the morning or evening. But what I see in women who come to me feeling, fatigued, especially in the morning, can't get to sleep at night, tired and wired, stressful job, we can look at their cortisol curve. So it's kind of like a graph that shows you when you're secreting it at the highest levels and when you're not. And when we want cortisol to be, we do need cortisol,
I'm glad you're saying that. I wanted to discuss that.
Yes, we do need it. Without it, we'd be dead. We wouldn't wake up. It helps us to wake up in the morning. So it is critical, but we want it to be secreted at the right time. So in the morning, we want there's about 3 pulsations, 2 a.m., 4 a.m., 6 a.m., depends on your circadian rhythm and your sleep cycles, but that's kind of the general time, and it helps us to wake up. It's our get up and go hormone, and cortisol.
And it's highest in the morning as well, right? The cortisol level is highest in the morning, and then it's kind of slowly going down. It's supposed to be going down. Right? I assume not for people, especially the people that you see, the cortisol level might be kind of level or go up or something, right?
Right. Correct. So we can see all sorts of trends on the cortisol curve. We can see elevated across the board. That is obviously
red flag.
The adrenals are pumping out cortisol too much in the morning, too much in the midday, like stressful life. And then we can see low cortisol in the morning when you need it to wake up. That individuals reporting I'm exhausted in the morning and I'm wired at night and I can't get to sleep, and they have elevated cortisol at night. And then we can see it low across the board, where they've hit a place of adrenal exhaustion, where they've been, in a stressful period, or their body is interpreting the experience that they're in a stressful period for the, maybe months, maybe years, but it's a chronic fight or flight reaction. And it's really crazy, because I don't know if you've ever experienced this, like speaking on stage, or maybe when you started your podcast, how the brain can trick us into make our body feel like, this is not a safe situation, even though it is. So the body responds to the messages that the mind is sending it, and so I like there's such a mind body piece to this. I'm sure you've seen that.
About that.
In the women that you work with. What is that?
Yeah. So one question out of curiosity is, you said that, some people have like too low cortisol, for example, in the morning, and they feel wired in the morning, and then at night they can't fall asleep. Why? Like, how is that explained? Is it because the adrenal glands are already so, they have overproduced so much cortisol that they can't produce enough anymore? Or like, how is that connected?
Yeah. So the great question. So what's happening in that situation is, it could be a number of things, but where I see that most common is that the woman has stress later in the day, stressful home situation, stressful family situation, kids, work, and secreting cortisol all day long. Maybe works a night shift, maybe has worked a night shift, maybe has had a flip schedule, working, if you're like a server or a bartender, there's lots of jobs where people are working late at night, maybe in a gas station, I don't know. But so having a shifted schedule can change that. And then just the body feeling stressed. Maybe when you go home, you're coming home to a potentially chaotic house. There can be other things that influence the ability to fall asleep. So we know that cortisol and melatonin are opposites. They are like arch rivals. So we can test both of those levels, and we can see that if someone has low melatonin, their cortisol is high. And melatonin, is that hormone that helps us get to sleep at night. So there's certain things like looking at blue lights and, exercising late in the day, and that can drop our melatonin, and therefore, when melatonin's low, cortisol is high. And so they're in this dance together. So kind of it depends on melatonin as well. Things that influence melatonin and will increase cortisol. So even like looking at a screen, a bright screen for 2 hours before bed drops the melatonin, can have some impacts on the cortisol because it's stimulating. So there's a number of things, shift work, but that's just kind of what I've seen in the women that I've worked with.
Yeah, really interesting. And if I remember correctly, and if I am well informed and educated, cortisol is also responsible for example, for weight gain, right?
Yes.
So how is that connected? I think that's really important to note as well.
Absolutely. So what can happen is that when we're in a stressful situation, we're continually outputting cortisol. The adrenal glands, which are located right above the kidneys, there's 2 of them, they're outputting cortisol. The brain is saying, I'm in a stressful situation. We got to get through this. And so cortisol is very linked to blood sugar regulation, which is a piece that I think goes unnoticed because when you find someone who's in a stressful situation, or their body is in a perceived stress for multiple years, maybe it be med school, grad school, stressful work environment, stressful family situations. I mean, everybody has had something like that. But usually they're reporting like waking up in the middle of the night, uh, or like I need to eat every 2 or 3 hours. I can't go long periods without food. Like I'm always hungry.
Mm-hmm.
And that's a dysglycemia. So the blood sugar is imbalanced. It's not able to, you know, kind of keep a steady state. It's up and down. And this is what also happens for years before type 2 diabetes is diagnosed.
Mm-hmm.
It's that kind of insulin spike and the glucose dysregulation. So, what can happen whenever we do have those blood sugar spikes, we're in a storage state. The body's like, oh, we got tons of glucose. Let's just shuttle into the cells, store fat, and the best place is the abdomen.
Mm-hmm. We all know as women.
Right. And that's a, common thing after a stressful situation. People will say, I work out, I'm dieting, I can't get rid of this abdominal fat. And that's, stress related, dysglycemia, blood sugar not being regulated.
Mm-hmm.
And then, there'll also be sleep disturbances as a result. So insomnia, waking up in the middle of the night, either in a panic state or hungry. And what's happening there is so you're asleep, your blood sugar drops, cortisol spikes. Your body says, wake up, we're hungry. We
Mm-hmm.
need to balance this blood sugar right now. So cortisol spikes, wakes you up just like you would want to happen at 8 or 9 in the morning or whenever you wake up.
Mm-hmm.
But it'll wake you up, tell you to eat. It's a dysglycemia. So the blood sugar is very, very tied to the cortisol output. Cortisol spikes, and then has blood sugar, spike and drop blood sugar. So yeah, the abdominal storage of fat, the blood sugar dysregulation, insulin resistance. So when this goes on for years, we get resistant to the insulin that the pancreas is putting on. The insulin helps to shuttle the glucose into the cells for energy. And what else? It can impact bones. So constantly outputting cortisol can decrease bone mineral density, which is also an epidemic in the United States, especially in women above 45. So
about 45%.
Like just when they're age 45 and onwards. Yeah, kind of when the hormones start changing around 50. Estrogen drops. If cortisol is high, bone is a living tissue and it's going to start breaking down because cortisol is
way faster than it's supposed to be. Yeah.
Yeah, cortisol is a catabolic hormone, which means.
How long have you practiced as a doctor?
Say that one more time.
How long have you practiced? So
I graduated in 2018.
Okay.
Yeah, from a med school in San Diego.
Okay.
And I practiced in San Diego for a bit, and then I moved up to Redondo Beach and have had practice here for about 5 months. So, yeah.
That's exciting. Yeah, because I wanted to ask you if you would have practiced longer, if you have seen kind of a difference already. But I assume that because you've been practicing so lately, probably all of the people that you meet probably have pretty high cortisol levels.
Yeah.
And yeah.
Yeah. Yeah. And cortisol impacts men as well. But what we see in women is a lot of endocrine effects. So appetite dysregulation. So the leptin and ghrelin is I'm hungry, leptin is I'm full, hormones that regulate our appetite, those are also thrown off with elevated cortisol over a longer period of time. So we end up, all of these metabolic effects of elevated cortisol over time can lead to chronic conditions like type 2 diabetes. And then what we've also seen is elevated cortisol causes an inflammation response in the body. So it can release what we call in medicine pro-inflammatory cytokines. And these are, they're released as an natural inflammation response of the body to respond to. And there's also a model of depression. We used to think, the model of depression was defined around serotonin. There's not enough serotonin in the body. Now we're looking at the model of depression as an inflammation model, so inflammation in the brain. So we're looking at the pro-inflammatory cytokines. And I've worked with patients in pain in clinic, over that past several years. And when someone's in pain, you can almost guarantee that they have cytokines floating around in the body. Inflammation, right? Pain and inflammation. And when somebody is feeling depressed, we also can gander that they have some cytokines, some inflammatory molecules, pro-inflammatory cytokines floating around in the body. So the depression and pain are highly correlated. And then the cortisol and all its metabolic effects can lead to the release of those cytokines, and that's why chronic stress for a long period of time can result in mood disorders, pain,
mental, physical, everything, basically.
Yes.
And so you mentioned something really interesting. I actually work with both. I work with men and women.
Great.
So one of the things I'm curious about is that you said that it's a little bit different between men and women in terms of like cortisol levels. Do you just practice on women or also on men? And if you look at lab results and things like that, what would you see as a doctor to be different?
Yes. So that's a great question. There are the things that are similar are the impacts on blood sugar. So men can get that same blood sugar dysregulation. They can also store the abdominal adiposity from the blood sugar dysregulation. They can also get the insulin resistance. I think the insulin resistance picture is really common in men. We look at obesity and like type 2 diabetes and kind of metabolic syndrome of all of these pieces, elevated blood pressure and the lipids are elevated. And, for men, it seems to be almost like more of a cardiovascular lipid, and heart, that leads into
like heart
disease later on in life. If that's not addressed early on, that's a chronic illness. So, but for men, what we see with elevated cortisol is testosterone is impacted. For women, we can see that impacted in the ovaries, in the conversion to thyroid. We have a less effective conversion to active thyroid with constant cortisol release, constant stress, and our thyroid is, regulating our temperature and all of these things. So for men, we can see that too. Thyroid conditions are more common in women, especially autoimmune conditions. And what's happening in autoimmunity is where the body's attacking itself, and that could be due to the level of inflammation, the pro-inflammatory cytokines, and the cycle that doesn't stop. But for men, we're seeing, I think, more now than 40, 50 years ago. We're seeing men in their 20s and 30s with really subpar testosterone levels, and even men in their 50s too, but younger and younger men are having lower testosterone and more insulin resistance, more elevated lipids and cardiovascular risk younger in life.
Yeah, that's really interesting. I actually just read a super interesting article about how from prehistoric times men had like these kind of these quick like stress like spikes because they had to like chase food or like they had to take care of bringing food home. So they were used to having stress, but just kind of at really like small spiky kind of periods of times.
Right.
And women are actually used to from prehistoric times having these like constant stresses, which is why they are saying that women are actually more resistant to stress, right? We are like making the food at home and we're bringing up the babies and we're doing all these different works, and that kind of really comes back to prehistoric times where where the woman was exposed to stress over the day, over the course of the day. So nowadays women are actually able to handle stress better. Like they don't realize it when they don't realize it when they are stressed, because we are kind of prehistorically used to having more stress on a constant basis. So when women start to realize that they have too much stress, it's often too late because we don't like recognize the signals. And men are maybe even more aware of stress, but obviously there's other things coming into play of why they might not be aware of it or don't want to look at it, or distract themselves from the stressful situations, but they are not so used to constant stress levels because they prehistorically that's not what the body had to deal with. And I thought it was really interesting.
That's fascinating. Thank you for sharing that. That's really interesting. I could definitely see that, because the women are, super women. Exactly. I could do, the mother, the mom, the wife, the, business owner, or,
Exactly.
So
we're dealing with a lot of different roles, right, at the same time. So that was really interesting. Okay, so you're doing lab results, and obviously you're looking at a lot of different things. So what happens then? So you're obviously, meeting with the patient and you're sharing with them the results that you're seeing. And then what are things, so let's say, for example, somebody is listening right now and they're like, maybe they don't have time to go to a doctor. They don't want to get lab results. But they have other warning signals that give them an indication that they're starting to have too high cortisol levels, right? They maybe cannot fall asleep at night, or they're having trouble to get up in the morning. They feel that there's like a, discrepancy or imbalance between melatonin and cortisol, or they have other symptoms. What would you as a doctor kind of recommend to do in that kind of situation?
So there's lots of things that you can do at home. You can do setting habits and strategies to help your body and your mind to disassociate with the feeling of chronic stress. One of them is meditation. And they show, there's like so many studies on meditation now that shows how cortisol levels decrease, how sleep is better, how it improves your ability to cope with any other thing that happens that day. Like, there's so many benefits of meditation. So I think that's one thing that's really powerful. And then, adrenal adaptogens, so utilizing things to help on a physiological level, helping our body to cope with that stress as we're experiencing it. And I feel like adaptogens are not really well known in a lot of the patients that I meet with. It's not really common knowledge. Using some of the adaptogenic mushrooms like lion's mane and reishi and chaga, and I think those are becoming a little bit more mainstream.
I think especially mushrooms, right? Like they put like now these mushroom powders into coffee, and like I'm starting to hear more and more about it.
Yeah, me too. The mushrooms for sure. Some of the other herbs are maybe a little less known or utilized, other than by a holistic practitioner, like a doctor or someone of that nature. So So that's something that can be used. I will emphasize, the importance of seeing a practitioner. There's
Mhm.
so many things, like, I encourage all my patients, and when they come in and they've done their research and they're doing all these things already to support their health,
Mhm.
I'm like, yes, absolutely. I'm so proud of you for doing that. You're your own health advocate,
Mhm.
and you got to be. Um, but there is a lot of guesswork that
Mhm.
happens.
Mhm.
When a woman is having all these symptoms, and there's so much interplay between all of this, the thyroid over with the adrenals, with the ovaries, and the gut. If we're not absorbing nutrients to
Mhm.
actually make neurotransmitters, and to need B vitamins for the adrenals to function. So, but you could be taking supplements and not really know what system or what deficiency there is, and
Mhm.
just kind of throwing the kitchen sink at it. And there is a huge advantage to just test it. You know what's going on. You can pinpoint the problem,
Mhm.
and really treat that so that your body is being supported in the way that it needs to.
Mhm.
Um, so I love both. I love being able to kind of be the detective
Mhm.
with a woman, or even for men too,
Mhm.
um, in their health journey, and being able to show them in black and white, this is what's going on. It's not your fault that you're feeling anxious, depressed, that this has been going on, that your body is storing fat. Like, this is why.
Mhm.
And I think that that brings a lot of resolve and motivation and hope to people to just see it on paper and
Mhm.
know that exactly what we're addressing is going to help, and kind of support their body, and reduce cortisol and support blood sugar regulation, and kind of reverse the
Mhm.
process that might happen. So
Mhm.
yeah,
I
but
I like that you say that. I think it's important as well, especially because sometimes we need to kind of have it on paper and on black and white to see how maybe our health is looking, right? In order to maybe
yeah.
see the gravity of it, and or maybe how far gone we are, or whatever it is. Um,
Hmm.
I'm thinking, one of the things that I think we always need both, right? We need the body mind connection. And what I'm teaching a lot is that we can work on the body, right? Like we can get the test results and
Hmm.
see, what is maybe deficient and what am I doing wrong and what kind of effect has the stress on my body. And we can work on that from a physiological
Hmm.
perspective again. But then I'm always saying, but
Yeah.
what if you stay in the stressful job? Or what if you're not
Hmm.
learning how to manage the stress? Or what if you're not learning how to manage the trigger, and look into that? Then you can work on your body as much as you want. But if you
Hmm.
don't learn at the same time as well to manage the stress better, and maybe look at your triggers and understand why that stress response is being activated over and over and over again throughout the day,
Yeah.
then it's just one part of the puzzle, and you need to kind of put the two puzzle pieces together to really like create a really healthy life.
I love that. I love that. No, I couldn't agree more. And I think that that's where the psychology of, working through that, and why is my body responding this way, and
Mhm.
using, visualization, meditation, journaling, counseling,
Yeah.
having a close friend that you can confide in, whatever it may be. I think,
Mhm.
yeah, that has to be in place.
Mhm.
You know, kind of addressing the triggers, and allowing the mind to calm too. Yeah,
Yeah,
powerful.
definitely very powerful. And so you were saying, I'm actually really curious. You were saying that you had this conference or this talk at med school about chronic stress, and that it blew your mind. Can you tell us a little bit more about what you learned, or maybe what was some new information that you weren't aware of before?
Yeah. So the link between chronic stress and depression, that has to do with the pro-inflammatory cytokines that are released,
Hmm.
just from overreaction, like cortisol output for months, years on end, can cause that. It can cause. So what happens is that your body loses what they call negative feedback. So the HPA axis, which is essentially the brain to the pituitary to the adrenals, it's the messages that are being sent to signal the process of cortisol. And that's how the mind and our fear response can actually signal a physical response in the body to release cortisol. So we lose feedback. It's kind of like the brain is screaming at the adrenals for years, like, make cortisol, make cortisol, make cortisol. And it's kind of like a mom and a kid, where the mom is just like screaming at the mom, and it's like she loses, she's like desensitized to it because it just becomes background noise, or I don't know, something like that. But the body will lose that. It'll like quit listening. It'll be like, I am so sick of hearing keep making cortisol message. So it becomes less effective at doing so, disrupts that communication between the hypothalamus, the pituitary, and the adrenals, causes HPA dysfunction. And we know that in people with severe depression that they have HPA dysfunction. We can look at that. We can actually test their urinary levels of cortisol, or their blood or their saliva, but urinary levels are elevated a lot of times. And then we'll find that their sleep patterns, their circadian rhythms are off because the cortisol is off, because the melatonin is off. And then we also find that cortisol is secreted more at night in people with depression. So there's so many, like, we're looking at all these physiological markers and being like, oh, this is why, and these are all correlated with depression. They've done studies in like medical students, and they've shown this specific cytokine that's elevated in studies, showing the link between chronic stress around like exam time and their mood, and the elevation of these inflammatory cytokines and the relation to the depression, and or just could be just decreased mood, so usually when someone comes in to see me with like a common thing, if they haven't had any lab testing or they're just feeling fatigued, they're like, I don't know, I think I might have some adrenal fatigue. It's kind of commonly thrown around, and that's really what's happening, is that you lose, the brain is screaming at the adrenals to make cortisol for months or years on end, and it's working so hard, and then it loses it quits listening, and it becomes less effective, and then we have, that's kind of where all of the metabolic things, the insulin and all of that comes into play. So.
And from what point onwards do we talk about chronic stress? Is it like when you are stressed for 3 months or for 12 months? Like, is there like a definition of when it becomes like chronic?
Yes. So there's, they like to talk about like 3 different phases.
Okay.
So there's like the alarm phase, which is the moment that you're, say you get a call from your boss, and you might you panic for a minute, right? Or, somebody calls you up on a stage and you weren't expecting it, in front of hundreds of people, and it's like your heart starts pounding, you start sweating, definitely an alarm phase. And then that's like seconds to minutes, right? That's kind of short-lived. And then we hit like resistance. So that's kind of the next stage, and that's from minutes to hours, and that's more of when you have the HPA, so the hypothalamus talking to the pituitary, talking to the adrenals, and that's kind of where the inflammatory response is happening, when we're thinking about pro-inflammatory cytokines, and then the third stage is like our body is always trying to find this place of homeostasis, which is
balance.
Yeah, right? It's kind of an underused word, I think. But so I was trying to find balance, and the adrenals are doing that as well. And so when it can't find balance is when we have all these issues. But it's trying to kind of balance the inflammatory response and the response in the adrenals, like once for what goes up must come down. So if we can't find homeostasis, we end up with all of these kind of remnant health problems and chronic disease that can manifest over many years. Yeah.
Okay, so it is really, so we have 3 phases. One is just seconds to minutes. The next one is kind of minutes to hours. And then I guess the third one is the one where it's constantly,
yeah, so
where there's constant stress and constant disruption of the processes of how they're supposed to be looking.
Yes. So that's the chronic stress is more manifested over months, weeks to months. Yeah. And the body's trying to find homeostasis. It's trying to, come back to a place of balance. And if it doesn't, then we're in a chronic state of cortisolemia, constant release of that. And it's crazy because they've actually found that there's like loops that even if the chronic stress ends, the body can still be releasing like NF-kappa B and IL-6, which are some of our pro-inflammatory cytokines. It's wild how that signal will like turn on this wheel that keeps spinning and keeps spinning. And that's how you can see that people are in pain for years, fibromyalgia, and how depression happens where we're constantly releasing pro-inflammatory cytokines. There's a lot that we can do to support that. We can work on inflammation pathways. There's all sorts of anti-inflammatories. Can work on the mind-body connection. We can work on the gut. There's a lot of things to support, but it's really wild what chronic stress over months will do to almost every system in the body.
Yeah. And depression, is that then kind of months to years? Because, I've been reading a lot about kind of the difference between burnout and depression, and was surprised to see how closely tied they are together. And there's not really a huge difference. They say like burnout is more like work-related stress, and depression is kind of everywhere where you have kind of negative thoughts about everything. Even though I'm always saying, I feel like when you're burned out and you have like so much stress at work, it will obviously impact also your private life. But I had burnout last year and anxiety, and I didn't realize that for a really long time, and that's kind of what I'm trying to obviously educate people on as well. And I would say that I was probably in that state for 2 to 3 years. It's obviously not that I've been just kind of negative for 2 or 3 years, but it's ups and downs and ups and downs, and then the ups get not so often, and then the downs stay longer, I guess. But is there any kind of duration or something where you're saying, oh, if you've been in that state for X amount of time, then that leads to the depression, or that's when we're talking about depression?
Yeah, it can be variable for different individuals based on, the level at which their body has resources to respond to that stress. So, and that can be related to, their nutrition, their B vitamin status. It can be related to their methylation, so their ability to methylate, and which is a whole nother topic, but methylation plays a role in depression. So it can like
what that means?
Yeah. So there's a genetic marker that we can look at in people, and it's called MTHFR. There's a very naughty nickname for that because it almost looks like the F word, MTHFR. So it's a genetic SNP that we look at, and if it's methyl tetrahydrofolate reductase, that's what it stands for. But if that in your genetics, and or my personal genetics, if that gene is not working as efficient as it should be, and it's very common, we cannot. There's this methionine homocysteine cycle, and we need methyl groups, which is essentially a biochemical reaction. So we have to add a CH3, a methyl group, in order to process it. So we can get stuck on homocysteine, and homocysteine is an inflammatory marker. We can run that lab test, and we can actually look at, it's part of a lot of standard labs, look at the homocysteine level. And if we see it through the roof, we're like, oh my goodness, they probably have an MTHFR mutation. So they're not processing this as well. We can support their body with methyl donors. So like SAMe, there's a whole bunch of methyl donors, but the MTHFR mutation, if not supported with methyl donors, is also very highly correlated with depression and mood dysregulation. So when and many other things too, but depression is one of them. So when we look at anybody with anxiety or depression, mood dysregulation, I'm looking at cortisol, I'm looking at genetics, I'm looking at, all these different pieces that we can support them on, support their body. So yeah, I can't remember where we're going.
And then when you diagnosed burnout or anxiety, or like these different mood swings in people, how long would you say from a physiological perspective, when you start to help a person, like how long does it take to kind of get out of the depression cycle or of the burnout cycle? Because I've been talking to people where they're like, oh, I know people that they've been burned out for a year or two, and they're just not getting kind of back. Like it's tough. So how, like from a doctor's perspective, I'm really curious.
It's so common. I will say that I mean, when you deplete the body, or you get the chronic stress cycle, and there might be some missing loops in the body kind of recalibrating, recalibrating everything. But how long does it take? I mean, it could be anywhere from a couple weeks. I think the best thing to do is test for it, because when you know that there's a MTHFR genetic SNP that's contributing to the mood, or that there's some intestinal permeability and lack of nutrient absorption, and that's can't absorb B vitamins, can't absorb a lot of the things that are going to help balance the neurochemistry. When we kind of pinpoint that, we can treat it right away. Nip it in the bud so it doesn't turn into anything more chronic. I think that's where naturopathic medicine, functional medicine, and the way that a practitioner who's looking at every aspect of the body can really serve like anybody really well, because it's protective, it's preventative, and then when we have a way to kind of pinpoint what's going on, we can not have to play guesswork. A lot of times, sometimes like with hormones, there's a little bit of a dance between balancing that. And so like with bioidenticals, for example, but when we know that certain things are low or high on a lab, like out of range, we're like, yeah, it's very clear what's going on. And we can treat that. So anywhere from a couple weeks of being on a protocol to a couple months. Depends how chronic it is. It depends
how long they've been suffering. Yeah.
If they're currently in a stressful situation in their life, that's also a preventing potentially progress. But we can also support anybody in a stressful situation to cope with it better and help their body to process that better.
Yeah, it's really interesting. I'm just thinking, like, I went to another holistic practitioner last year. They asked me to fill out a couple of kind of health questionnaires, just to see kind of how I felt. And that was very eye-opening for me. And that's how they diagnosed me with burnout and anxiety. And I was like, oh, wow. Like, I didn't know what was going on with me until I kind of had the papers in front of me, or the doctor in front of me telling me what was going on. And then it made a lot more sense to me as well. And they actually ran some lab tests as well, but they didn't find anything. And I don't think like all of the things that you're mentioning right now, all of the different hormones, I don't think they tested that because it wasn't a holistic
Sure.
practitioner. And now I'm thinking, I'm like, oh, this
Okay.
would have been so interesting to actually look at while it was so acute, right? And so chronic for me.
Yeah.
And I took a long time off of work to kind of deal with it myself and to work on the mind and work on the body and decrease those cortisol levels. And it took me a long time because I didn't take any medication. I didn't take any antidepressants or anti-anxiety medicine because I don't really believe in it. I'm like, if something is going on, I should pay attention. I should kind of go to the root cause instead of just treating it with some type of medication that makes me feel better, maybe short term. And I felt like my anxiety actually got worse almost the first 4 weeks after I was diagnosed. And maybe has that something to do then with what you were saying, that it just kind of, the body just kind of continues on that level for a while because that's just kind of the response of it?
It can. Yeah, it definitely can be like a feed forward loop that's hard to stop. But that's not to say that there isn't hope. And I love that you shared your story. And I went through a similar thing coming out of med school. Like I remember trying to start my practice, being completely exhausted after 3 days of written boards and 4 years of med school and clinicals and no break for 10 years of school essentially. And it does a number on you. Me, it did. And when you can test those values and kind of see what's going on, it took a lot of the, why am I not feeling motivated? Why am I not feeling able to rise to this challenge, which is very energy intensive process, to start a clinic or to build a practice, and having it on black and white and paper and seeing, I need to support my body more because I've been hard on it and it's been experienced in this cortisol and feed forward loop for probably 3-4 years at least. So, and that, I think it brings so much compassion for the experience, for ourselves, for the experience that we've gone through. Like, thank you, body, for helping me to withstand that and to persevere, and I'm grateful for that experience because I can also explain that and know what it feels like and know what know what the testing looks like and how to support. I'm constantly learning to support myself as I mean you are in supporting women that are under stress. So it's like the best place to speak from is personal experience, right?
Yeah, for sure.
Powerful.
And for me, I'm just like thinking, you are a doctor and you knew kind of what's going on, and yet we are putting through this pressure the whole time, right? And I just recently read as well a quote that I found so powerful, where it was like, we are so smart human beings, and yet we are so dumb in what we're doing to ourselves sometimes. What we are putting ourselves through, and I was like, oh yeah, that's very true, right? We're like, we're all. I'm working with a lot of very highly intelligent, smart people that are very, very, very educated, and yet we are completely dismissing the signals that we're getting from our body, and we're distracting ourselves and we're numbing ourselves. And I really hope that more and more people will understand that it's really important to take care of stress and move that around, right? And to kind of use it to their advantage, use the energy that they have, but then also find those relaxation states throughout, on a regular basis, not just twice a year for 2 weeks when they're going on vacation, in order to really pull that together and use it to their advantage.
Beautiful.
So I'm really excited about all of the information that you just shared. I always have a few questions at the end of each podcast interview, and the first one is, what are you most grateful for?
Oh, wow. Well, I have to say just the relationships in my life. because I think that is such a powerful force for combating stress too, is feeling
Mm.
supported
Yeah.
and having loving relationships. My parents have been relentlessly supportive in med school and this journey and launching, my own medical practice and everything. So they're priceless and so important to me. My aunt has been a huge mentor in my life. She's, kind of had a similar journey to me, and she left Minnesota at a young age, and she's like inspired me so much in how she's built a life and faced a lot of stress and like come out on the other side of it and has
Mm.
this really beautiful life. But she's a living example of a woman who's worked and at a high level and undergone so much in her life, and that it's possible to go through these periods and come out
Yeah.
stronger,
Yeah.
and then my boyfriend Dan, who is in naturopathic medical school, and we have such a shared passion for this medicine and what it can do for people and how we're able to offer better treatment and preventative and looking at labs in a whole new light that
Mhm.
is a game changer. Like it can really move the needle for someone, and more needed than any other time in history, I think.
Mhm.
So like his love, his support, his like shared passion with me has been completely uplifting and encouraged me, when I have gone through some of that adrenal fatigue post med school. And so he's been definitely a rock in my life, in the last year. And then, yeah, I think the relationships are really, you can look at all the professional success in the world and money and fame and, but when it comes down to it, like those relationships bring us the greatest joy and happiness. So that is a huge part of, I think, even offsetting stress in
Yeah.
life. Yeah.
And they bring us the biggest trouble as well,
Hmm.
they're not.
That's true.
So
The
yeah,
biggest
I totally
heartache.
agree. It's very important that it's very balanced.
Yeah.
Because
Yeah.
if we have all the money in the world, but the relationships are not well, then we're probably still not very happy people. Yeah.
Yeah, exactly. Yeah. We're
Do
so
you have
stressed.
three, like maybe wisdoms or three kind of general rules that you live by and that you kind of try to always remind yourself of?
Hmm. Well, I think, yeah, there's, in regards to stress, there's another naturopathic doctor that I refers patients to me, and it's a phenomenal doctor in LA, Dr. Christian Gonzalez, and he shares a lot about consciousness and like a lot of processing stress. And he was talking about how fear is an illusion, how it's something that we make up in our mind. Like when I'm about to walk on the stage or I'm about to speak or do anything, that it's something that I create in my mind. It's not even reality. And so, um, like repeating and understanding that we can calm the mind, that fear truly is an illusion. It's created by my own brain,
Mm-hmm.
and I can control my thoughts, which is the work that you do.
Yeah.
It's very profound. And so fear is an illusion. We either live in love or fear. We can't be in both,
Mm-hmm.
right?
Mm-hmm.
So if you're living in fear, you're not in a state of love. And when we're in a state of love, we're doing good things for our body. We're nourishing ourselves. We're nourishing our spirit. We're nourishing, in relationships. If we live in a fear state versus in a state of love, fear is I'm worried about them not giving to me or being faithful or whatever, and love is I'm showing up energetically, just open and giving and
I
open
trust.
hearted.
Mm-hmm.
Yeah, trust.
Mm-hmm.
So I think that the fear and love can come across in our relationships, in our health journey, and how we approach our own health. I'm fearful I'm going to get this. I'm fearful of my own health versus I love my body. I love taking care of it. I love nourishing it.
Mhm.
And I love, all the greens, and I love, feeling good and living in this really vibrant state of loving, vibrant health and moving towards that if we're not there.
Yeah.
And yeah, so fear is an illusion. We can either live in love or fear.
Mhm.
Uh, and then for me, like the last year, I read this great book, which I know, this great book by Gabby Bernstein. She talks about how the universe, my relationship with God, higher power, the universe, whatever it is, for you, is the most important thing in my life because that is the direction, the wisdom, the guidance to, pursue a life passion, to show up with love. Because she has in her book, it transformed my life in a lot of ways, and like my own spiritual journey,
Mm.
and just like trusting, and um she talks about like daily kind of surrendering, being and saying, I trust I'm being guided. I need guidance from God or the universe for
Mhm.
this journey. And I think that takes just like so much off of our shoulders because we feel like we have to be in the driver's seat, in control of everything, that we're responsible for 100% of things.
Mm.
And, releasing that and just operating in more of a state of trust
Yeah.
is what happens when I connect with the universe. And I know that no matter what happens in business, no matter what happens in my relationships, no matter what happens, in the rest of life, that connection and that trust is, um, like a rock
Mhm.
and a guidance, and will also, you know, lead you into a place where there's fulfillment and there's love and there's, passion in your work, and so I think that's the guiding light, and has been, becoming more clear for me in the last year.
Very nice. What is the name of
Yeah.
the book?
Um, yeah, it's called The Universe Has Your Back. She has a couple
Yeah.
books, but
Okay.
that's the book.
Great.
Mhm.
I that was actually my next question. If you had like any book that has like changed your life, it sounds like this one. Maybe anything else?
This one, yes. So I actually I listened to Audible, so I listened to a
Mhm.
lot of audiobooks, and I went through my Audible and I was like, what is the best health book that I've recently, the best like kind of spiritual growth or, mental, emotional, and then the
Mhm.
best kind of like business. So the health related one is this book by Dr. Catherine Shanahan. She's an MD. It's called Deep Nutrition.
Okay.
And she works with, professional athletes on I think it's an NBA team, but she talks about, um, I mean, she exposes a lot of things in our current society about nutrition, and talks a lot about, uh, like omega-6 fats versus omega-3, and how restaurants are cooking with pretty much anywhere you go out to eat, they're cooking with some type of inflammatory oil. So an omega-6 oil that goes
Mhm.
rancid, it's cooked at a high temperature. And a lot of those oils are not meant to be cooked at that high of a temperature. And so how that's a silent killer, cause of heart disease,
Mhm.
all sorts of, inflammation in the brain, pro-inflammatory cytokines,
Mhm.
um, literally exposes all of it. It's a really powerful book, and
Interesting.
it's changed the way that I practice medicine too, I would say.
Mm. One question that I have, and that might some other listeners have as well, is why
Mhm.
is inflammation so bad for our bodies?
Mm. So it's not always bad.
Okay.
We need it.
Okay.
Um, when you fall and scrape up your
Mhm.
leg or something, we need the healthy inflammatory response. We need cytokines. We need that.
Mhm.
It's how we kill off pathogens and offenders. We need an inflammatory response. And we use it in all sorts of regenerative medicine techniques, which is actually another thing that I'm trained in. And they offer it at the clinic that I'm at in Redondo Beach, is, some of the joint injections where we deliberately cause inflammation in the area using the body's natural response for inflammation, to heal, to put down new connective tissue. So we need it.
Mm-hmm.
Where we don't want it is on repeat and overdrive, a record that will not shut off. We don't want that. There's certain pro-inflammatory cytokines. We need cytokines, but there's some that are worse than others, essentially, without going into the nitty-gritty of IL-6 and IL-10 and all the numbers and everything. But there's some that are better than others, and we want inflammation in bursts, kind of like we want, if we experience stress in bursts, we don't want chronic inflammation. Yeah. The chronic inflammation, the chronic release.
A lot of different diseases as well, right?
Yeah. Yep. Yes. Definitely underlying a lot of chronic illness. Yeah.
Okay. Sorry. So you said that your health book was The Deep Nutrition. And you said you had a business related one as well?
Yeah. So there's another book that I listened to recently, and it's called Millionaire in the Fast Lane. But the book, I mean, it sounds like a finance book, but he talks a lot about service and creating a business that has massive impact. When you're touching millions of lives, you make millions of dollars, and how that's correlated, and how the impact influence, how much are you able to impact either a vast number of people or a small group of people in a huge, huge way. And so it's really a book on like psychology around money and impact and business growth. It's really well written. It's a long book, but I think it's a good read.
Great. It sounds really fascinating. What is next for you? What are you planning to do over the next months and years?
Yeah. So I'm practicing in Redondo Beach. I'm also in Hollywood 1 day a week. So I see patients at a space there on Fridays. And so that's exciting. I'm doing, some talks up there, and getting to do some regenerative medicine procedures up there, which is exciting. And then really offering that here and connecting with a lot more women, serving a lot more women in that way. And then, so Dan, my boyfriend Dan, has a program. It's called Peak Performance Pros, and so that's something that we've put together where we're working with athletes and high level professionals, and essentially we're running functional labs. We're looking at cortisol, and we're doing it for very cost effective. We've done a lot of searching out labs that can run labs, and finding out the best panels and how can we run all of these to get a really comprehensive picture. And then we have a software that we plug it into that is beautiful. I mean, it tells you exactly where the dysfunction is, puts it in black and white. It adds a ton of value. So so we're working with athletes and entrepreneurs. We have somebody in New York who's, working in the stock market, and we have athletes that are in pre-NFL, like the league below that. And, we're doing that, kind of more performance optimization. We can look at nootropics and brain function as well, but we essentially running a lot of the labs that can be preventative, or, you look at these, a lot of young, healthy looking 30-year-old, 25-year-old men and women, and on the outside they look just fine, and you run their labs and they're a mess. And or there's certain things that are really out of range, and so we can really serve them to their best health and their best energy through doing that, and through making those recommendations. So that, and the other thing that I'm really excited about is, I don't know if most people haven't heard about it, but peptides. I'm not sure if you've heard of peptide therapy. So so there's all sorts of peptides that they're using now. They're different than a hormone. Hormones are like algebra, peptides are like calculus. So they work at a different kind of level, but we can inject things that help promote brain function and prevent neurocognitive decline, and help with muscle building and weight loss, and And they're through a compounding pharmacy. It's a prescription through a doctor, but there's all sorts of uses. Super exciting. Very few people know about it. There's a low barrier to entry. It's other than you have to work with a doctor and figure out, what's going to be better. There's some that you can take orally, but a lot of them are an injection, a sub-Q, so just below the skin. And I mean, I've used some of them on myself, just experiencing it, and it's really exciting to see what is possible, like for athletes, for brain function, for, pretty much any need. So I'm super excited about that, and I'm planning on working and doing a lot more work with the peptides.
Very, very fascinating. Very cool.
Yeah.
So if people listen to you now and they would love to meet you or schedule an appointment, I assume they can only do that if they are local in LA?
No, so I can meet with people virtually. Ideally, I like to see people in office the first time once, but we can do pretty much all the follow-up virtually if they live, LA is traffic, so even people in LA might want to do a virtual visit. Yeah. But yeah, I can see people. We can run labs. We can just send them to a lab that can draw their labs near them. It's not an issue. And then, we have people in New York and that we can run labs for and work with. So,
okay. So how would they best get in touch with you if they are interested?
Yeah, so you can go to drambernd.com. So Dr. drambernd.com. They can also find me on Instagram, which is where I post a lot of, kind of.
Lots of very cool information. I've been following you for a while now.
Yeah, lots of fascinating things about holistic medicine and labs and kind of what I'm up to. And so that's Dr. DOCTOR. So doctor spelled out Amber ND on Instagram, and they can always reach out to me there if they want to connect further. Otherwise, you can go to my website and schedule an appointment that way.
Awesome. Yeah, and I will put all of the information in the show notes as well. So
great.
People did not have a pen and paper right now.
Yeah.
They can just go into the show notes and click on the links as well. I'll make sure that I put them all in there.
Awesome.
Great.
Thank you so much.
Well, thank you so much. That was so interesting and fascinating to speak with you. Thank you so much for taking the time. I really
absolutely. My pleasure. Thank you so much for being flexible so that we could make it happen today.
Yeah. It was great. Yeah.
Yeah. Such a pleasure. So, all right.
Thank you so much. Talk to you soon, Amber. Bye.
All right. Talk to you soon. Bye.
If you enjoyed this episode, I would be extremely happy and grateful if you could leave me a comment and a 5-star rating. If you know someone who would benefit from the information I talked about today, please feel free to share it with them. No matter if it is your friends, your colleagues, and/or your family members. You will always find all links and a summary of the podcast in the show notes. It would be great if we could connect on Instagram or via email. You can find all details of how to find me in the show notes as well. In that way, you can also send me any questions that you might have. And as I mentioned, I also have a wonderful YouTube channel now where you can post comments and questions, so please reach out. I'm glad you're listening to this podcast. Thank you so much for your trust. With gratitude, Julia.